welcome to this week's episode of Association Transformation, the regular podcast brought to you from Console Strategy here in the UK and Brewer Pratt Solutions over in the US. I'm Andrew Chamberlain, Managing Director of Console Strategy.
And I'm Elisa Pratt of Brewer Pratt Solutions.
And every week we make it our mission to invite guests on, spend some time with us, talking about the prevalent issues, the pertinent issues that are affecting us on a day-to-day, a weekly, a regular basis within the association world. It's a transatlantic conversation. We're very much about sharing our knowledge, sharing information, sharing ideas, sharing problems, finding solutions together. And this week, we're talking about the opportunities associations have had to leverage COVID in fast-tracking innovation. Listeners will remember that, I think it was way back in episode 1, which feels like an eternity ago now, Elisa, we spoke about purposeful abandonment, and we asked whether associations were using this, I can't even say hiatus in activities, but this disruption in operations, if they were using it as an opportunity to let some things go, to reprioritize, to abandon. What we found was actually that's not really the case. So we found
it was the opposite.
Yeah, exactly.
They weren't getting rid of anything. I think they were more afraid to get rid of anything, and I think that's what brought us to this topic, which was what opportunities is COVID providing to accelerate and innovate and push forward maybe more quickly than expected, because people certainly were not sunsetting programs as COVID gave an excuse.
Definitely not. I love that phrase, by the way, sunsetting programs. It makes it sound so poetic.
So gentle.
We're dumping this project because it costs us too much money. Let's sunset it.
We're going to slaughter this sacred cow. No, we're going to sunset your legacy program.
Oh, speaking of
I changed the voice too.
You did there, my God, it was beautiful. Speaking of sacred cows, Andy Burnham's joining us today from the British Dietetics Association. I'm delighted you're joining us, Andy, and also from across the pond for me and for Andy, Jennifer Personelli, the Executive Officer for the US Biophysical Society, is joining us. Welcome to you both. Jennifer, are you based in DC?
Yes, we are.
Good. Is any of your association in the US not based in DC?
A lot of associations are in DC, but still Chicago, in the Midwest, even all the way out west. But
there's pockets. There's pockets.
Okay, excellent. Well, I'm just hoping, one day Andy and I will get a gig and we'll have to travel somewhere to do something for our US colleagues. Isn't that right, Andy? Different Andy. My producer's putting his thumbs up. I was actually talking to Andy Berman, our guest.
Two Andys and an Andrew. It's a bit much this morning. Well, Jennifer and I have had the opportunity to work together before. And so when this came up, I thought of her almost immediately because she is a fairly new executive. And I thought, it must be not only scary, but exciting to be in this COVID situation as a new executive officer. And I wondered what kind of, experiments and risks she was taking with that audience, with her board. Jennifer, what's COVID done to you guys? Where is it providing you opportunities?
Actually, we've had a lot of really interesting opportunities. COVID has certainly accelerated a number of things that we've talked about or considered, or that our leadership has talked about prior to my even arriving at the organization. But that we've really sort of accelerated at this point. So for example, in February, we actually had our in-person meeting in San Diego, California, and our leadership was talking about, should we have more of our governance meetings virtually? Should we have any? We had none at the time. Should we have any virtually? And there was a lot of debate of, can we do this effectively? Do we need to be together? Do we not? And obviously COVID has forced that. So instead of test piloting one virtual meeting in 2020, all of a sudden, all of our meetings for the foreseeable future are virtual, and they're going extremely well, right? So our council meetings, our committee meetings, it's really been great.
That's great. Well, and you were lucky enough to get that February meeting in under the under the COVID deadline, I guess. How is the membership handling this? I mean, they obviously can't complain. I mean, COVID's affecting everyone. Are they, if the staff are rising to the challenge, are you seeing the members rise to the challenge when things have to be accelerated?
Absolutely. We actually had a lot of members reaching out to us saying that as they were moving into online education and teaching their courses remotely and virtually, they had tools they wanted to share. And they turned to the society and said, we want to share it with our colleagues. So we made a repository and a place through our website and our portal to stand up resources for them to share and expand their online educational offerings. And at the same time, we were trying to provide new content and new opportunities for them as well. We usually do virtual networking events. We usually do in-person networking events around the globe. Biophysical Society is an international organization, and we host a number of events at the local level. Our members volunteer to host these events and would have a seminar or a lunch and learn or something to that effect. And we transitioned this year to say, let's still do virtual networking. Let's do networking events, but let's make them virtual. And we had twice as many applications as we've had for the face-to-face events. So I think we also heard from our members that they really wanted to connect, and by the Biophysical Society providing them resources and tools, they were able to do so very easily.
This isn't this is no way directed at the Biophysical Society, by the way, what I'm about to say. But isn't this...
here it comes.
Yeah, sorry. I know I'm setting you up. No, I'm not. But doesn't not the Biophysical Society per se, but doesn't it just demonstrate this, the changes, the dramatic speed of the changes that we've seen in the association world over the last sort of 4 to 5 months? Does it not demonstrate that actually sometimes we're all guilty of just overthinking about what the member wants? And I don't, because, the 12 months ago, the prospect of saying to any association, everything's going online. Everything's going online. Forget, annual meetings, face-to-face networking. It's all happening remotely. I can't imagine a board that I would work with which wouldn't just fall off their chairs and laugh me out of the room. I mean, what do you think? I mean, Andy, is that not, am I being unfair? Or it just seems that we spend a lot of time second guessing what the membership wants, but actually maybe are we that good at it?
And that's one of the biggest risks, I think, that any membership association runs. Thinking or assuming you know what your members want. And we've always been really careful about that. We have always tried to ensure that every couple of years we refresh what we think we know about our members, because we ask them directly. But I think what you're reflecting is this complete paradigm shift that we've experienced over the last few months, whereby the whole horizon has changed for everybody. And our members' expectations and desires and beliefs are completely different, as are ours. And there is maybe a bit of a risk of actually we need to ensure that we're running in parallel with our members' desires and expectations. But as long as we keep the communication channels open, I actually think we've got this great opportunity to work with them. And for them to work with us, so that as we change the business model over the next year or two, to create this greater opportunity for online delivery and e-learning, for example, that it won't be this big shock that you talk about. Our board members won't fall off their chairs because they will actually be expecting us to take the lead in this respect. And they won't be on the back foot, they'll actually be on the front foot and saying, why aren't you doing more in this area? So I think that's the great opportunity we have, that we've got this opportunity for significant change in the way that we think and the way that we deliver.
Well, and I think what's interesting is their appetite for change and their ability to handle and accept that change is not only greater in the association space and their roles interfacing with their associations, but to Jennifer's point, in their own environment, in their own industry, in their own practice. They're dealing with all of this too. And so the value that an association can bring, not only sharing and being transparent about the decisions and issues they're facing and solutions they're considering, but then allowing the members to share what they've learned and the tricks and tools and solutions that they are putting into place. I mean, that was, Jennifer, I think that's amazing, getting to bring them together, not only in a new capacity, but to share with each other survival, how they're surviving in their own space. I mean, that's a value in itself. And you had a pretty good networking group to begin with.
Mm.
Is there anything?
I think that
go ahead. I'm sorry.
I was just going to say no. That I think that part of the benefit of all of this is those. I mean, use the metaphor of ripping off the Band-Aid, right? This is going to be painful. Do we really want to make this change? And this has forced the change and opened up people to things they thought they just that would never work before, because it was not how they were used to doing things. And so this really kind of pushed them in a new direction. And I think it's really opened up a lot of opportunities. I think there's a lot more thinking about what else can we do and how else can we evolve this and move things forward.
Yeah. Their appetite for change, I think, has been expanded more than we may appreciate. And maybe we weren't giving them enough credit. Maybe we were presuming their opposition and leaders holding back because we assumed they would say no.
Yeah. Always. It's always a headache. Whenever you strategic plan with the board, there's always that. What will the members say? What will the members think? We can't do that because what are the members going to say? But us spending their money on X, Y, and Z, it's a perennial headache. And to the point where I think for a lot of organizations, they've just been paralyzed. They've just been paralyzed not by fear, because, fear of how the membership will react. It always just feels a little bit like there's a lack of perspective around, when we're talking about the membership, like they're this ethereal body who, if we put a foot wrong, then they're going to smite us, or and what have you, or worse, pull their £65 membership fee off us. But I'm keen to talk about the BDA, Andy, because I know that you guys have done. I mean, I've been watching you. That sounds awful. I've been spying on you, stalking you. I've been watching what the BDA's been doing over the last 6 months, and during the crises, and you've been prolific in terms of, in my opinion, demonstrating the value to the membership. But what does that actually look? But I'm only seeing it from one perspective. I'm seeing it from my perspective, which is why I can see they're doing something brilliant. They're clearly making some mileage in terms of innovation. But what actually does that look like for you guys?
So some of it was real innovation from the point of view of we were forced into a situation, as many of us were, because of the circumstances, whereas in some cases we were partway down a road of a journey, and we just accelerated on that journey. So in relation to the real innovation, being in health, our members are at the forefront of dealing with COVID, and we found that their demands were becoming quite clear. Their demands, the demands of the public, and the demands of other healthcare practitioners were really quite obvious. And the members had a huge appetite for actually producing content. They wanted to get information out there as quickly as possible. And between March and June, we saw something like a 300% increase in traffic to our web pages. As a direct result of us being able to put out on social media, because we had to react quickly. This is what we've got available. This is the advice. This is the information. Are you a healthcare practitioner? Are you a patient? Come, we've got lots of free information. And a lot of the information that we had previously made available for purchase only, such as our journals, our articles may be found within our textbooks, we just put it all online, and it's still there now for the moment. So we wanted to create much more content for the health sector, and that's driven a huge amount of interest. And as a result of that, people are saying to us, this is fantastic. How do I become a dietitian? How do I train? What do I got to go through? So we're generating interest in the future of the profession. The other point I was talking about was around we're on part of a journey. And coming back to partly to the issue of this acceleration down a particular path that maybe some members or our boards may be very uncomfortable with. Well, for some years, we have been moving, fortunately, down this path in any event. So for the last 3 or 4 years, we have held our AGM, our general meeting, every year virtually. We've provided the opportunity for members to gather in various parts of the country to come together face to face, but we've connected all these locations using technology. So we could connect the 4 countries in the UK. And so for us, the leap now to have a completely virtual general meeting is not that difficult to imagine. And we're working on it, and we've actually got that in 3 weeks' time. The same with our e-learning. We'd already started working on a whole program of work to convert a lot of our education and learning content onto e-learning modules. We've just accelerated that business strategy because we know that we have to reach a certain point. So some of it was really challenging. The first part was really challenging, and we had people, staff members included, working sometimes through the night to get content available because it was needed. Whereas it's just been a refocus of what we planned to do and just to accelerate down that path.
Oh, sorry. Go on, Lisa. I was going to ask Andy, but go on, you go.
Well, he mentioned the huge increase in web visits and also the increased awareness of the industry for future professionals. Were you already dabbling in career path and workforce development, or is that new for you?
That's a really interesting question because traditionally, dietetics was an oversubscribed profession. It was actually really hard to get onto a dietetic program. But what we've seen, because of various changes in the way that funding has been provided in the UK in the last 2 years, was actually a drop-off of the applications to universities to train as a dietitian. So the timing in some respects has been fantastic for us because while the numbers have been slowly dropping, there's going to be a resurgence, we think, because of our profile raising and because of the activity that we've done. And I think the timing of this has been really fortunate for us, and we'll go towards some of the activities we've already got planned to raise the profile of dietetics as a career for future students.
That's right.
But did you say that you put maybe I heard this wrong? Did you say that you put material that was previously behind the paywall? You've put it up You've put it up and it's freely available. Yeah.
Absolutely, yeah. So material from our published books, from our professional peer-reviewed journals, which normally you have to buy or subscribe to. We've put the relevant content, only COVID-related content, but we've taken everything out that's COVID-related and we've made it freely available.
Right, we've done the same thing with all of our journal content. We did the same thing that Andy did as well. And even our internal resources, as I was mentioning, that we posted a bunch of new educational resources. All of our educational modules used to be behind membership access only as well, and we've just opened up all of those to be freely available. One of the things that we understand is a lot of our younger members and student members and early career members may be actually challenged right now to maintain their professional memberships, but we want to remain relevant and a resource to them. So we've opened up all of those modules to be free to everyone right now as well.
So with that expansion, sorry, I forgot to raise my hand. With that expansion, you mentioned you're an international association, but now having taken those meetings virtual, obviously time zones would continue to be a challenge, but are you actually now expanding membership and seeing an influx of members either domestically or internationally because of those opportunities?
We are hoping that might be the case. Our membership cycle, we just opened on 2 weeks ago for our next cycle of renewals and actually meeting registrations and things like that. But we're hoping that everything that we're offering in terms of virtual remote programming, support, resources, again, some of it is completely freely available to anybody. But we're still hoping that we're providing enough new content and meetings and things like that at a good price point to hopefully attract new members. And yes, international members, our assumption is that for our annual meeting, there's a lot of people that always don't attend because it's either not convenient to travel, halfway across the world for a couple of days. It's very expensive, et cetera. But that our meetings being online will give a number of people who wouldn't otherwise attend the opportunity to attend.
But are we not risking undermining our business models if we're then putting everything freely available out there? I mean, I see Andy, go on, you put your hand up. Go on, what do you think?
I don't think we are, because I think that we do a number of things by taking this strategy. We show that we've added value. We show what that value is, and we show it to the outside world. We say, hey, yeah, you come and have a look at it. This is freely available for the moment. But this is the type of thing that we do. And it is great quality. It's great content. If you want to be part of the club, if you want to act, then great, we want you to come join us. But membership from membership associations is not always just about the take. There is something hugely valuable about the engagement and the connection with peers. So I do think if we use it rightly, it's a way to entice people in. It's a way that we can actually grow capacity by being selective, yes, about what we provide freely available, but actually demonstrating, if you want to be part of the club, this is what you're going to get.
And I think about that engagement and especially to Jennifer's point about the hardships that your members may be undergoing given the COVID circumstances. Is one of the new opportunities that COVID provides a chance to help members with funding? I mean, both of you, given your areas of representation in the medical and scientific fields, do you need to help your members with grants or to seek funding, or is that a new area of member benefit that COVID has given you an opportunity to help with?
So here in the BDA, we did two things. We looked at the groups of members we have who were not surviving through COVID because the nature of their roles, maybe they work as private practitioners and they were finding it much more challenging. And we identified who they were, and we cut their membership fees by 25% for, I think it was 3 months from March. And we're probably going to extend that a little bit further. And that was a way of that they're struggling and that we want to support them. We don't want to lose them as members. We want to support them. The other thing that we did is part of our organization is also a grant giving body. So we fund research and we have advertised quite widely to say, if you are thinking of doing something around COVID to develop your understanding of the science or improve healthcare practitioners, we want to fund you. We want you to come to us and tell us what it is that you need, because we have funding available. So come and talk to us, because we want to be able to help you. And helping you will help everybody.
And I would say for us that it is helping support funding. Our members' funding is something that we've always done, but this has certainly given us an opportunity to expand that. We've always provided grant writing workshops. A lot of our members are funded by a couple of U.S. federal agencies, in particular, the National Institutes of Health and the National Science Foundation. We've had grant writing workshops, but now we're also using our Public Affairs Committee to engage with people from these agencies to find out, what does their funding look like? What do these agencies anticipate in terms of federal dollars, and how will that translate to our members, to their institutions, and trying to provide some information, updates. We provide a lot of links to resources too for them to check on. Have funding opportunities been expanded? Are grant windows being lengthened? Or is funding going to be cut off for certain programs? So we've also been trying to collect and then share that information with our members to help relieve some of their burden on this information gathering.
I think there's something else, and I don't know whether your experience is also like this, Jennifer, in the US, but this has been a great opportunity for us to actually create partnerships with other like-minded associations and societies, whereby we may have been working with them already, or maybe it was societies that we maybe didn't think about working with, and the situation has dictated that actually we need to work in partnership, and we've come together and we've done lobbying of government, or we've been sharing resources, or we've been promoting information and content to each other's websites. And I think that's one of the other benefits of this past few months, in that we've actually been working much more collaboratively than we ever have in the past. We have done, but this has really accelerated that strategy.
I agree. We've experienced the same thing and very much found that other societies, especially scientific organizations, are willing to work with us, and we're sharing lessons learned and resources and vendors and all kinds of stuff. That is the collaboration at Society. Society has been fantastic these last 6 months.
That's great. That's great. Well, and thinking about that external focus and then turning it internal with other, you know, you mentioned vendor partnerships. I wondered, as executives, in terms of operations, what has this given you the opportunity to do? What has COVID forced you to do that maybe you were thinking about? I mean, we all know about, you know, remote working, but whether it's transitioning your staff or systems, what on that operational side has been the opportunity?
And so I can speak to that. We're a small organization, and so some of our internal processes were very much still manual. For example, the act of accounts payable, and having my director of finance bring me a stack of checks every week that I needed to sign off on and go through the reports. That's just what this organization has done for a long, long time. And the fact that we can't get together anymore, and I don't want to go into the office to sign a stack of checks any longer. You know, there are lots of software and AP programs online, and we finally have moved forward with that. Probably maybe slower and later than other organizations, but this forced us to go that direction, and it's been working really well. So it's a small example, but it turned out to be a great benefit.
I think it's a valid example, because innovation is only relative to where your starting position is anyway. So, you know, if we're talking about, you know, if you guys, okay, I mean, I know Andy sits on a small empire of staff at the BDA, but you know, for you, he has people who, you know, who bring the person the checks. They have someone who brings them the checks for him to come and sign. They, you know, is that but you know, but for you guys, that is that's, you know, an innovation, an operational, you know, opportunity to be more resource efficient. So actually, innovation, I think it's easy to kind of say, well, you know, unless it's some grandiose, not life changing, but some grandiose experience that's going to fundamentally change the way in which we members experience us, then it's not innovative. But actually, it doesn't need to be something that's always front facing. An awful lot of the time, what we do behind the scenes is equally of value to the membership, indirectly so. And I think that's always something it's worth just, I'm glad you brought this up, actually, Lisa, because I think it's worth, it's worth making that point, because so often there's always, even if it's a quietly silent question mark behind the value of how much are we paying our executive and what are they costing us, etc., etc. The reality is the executive in all its functions always provides real value to the membership.
Well, those operational efficiencies, they're never the sexy stuff. They're never, the member benefits and maybe even what you discuss with your board. But, I've talked to clients who are simply consolidating. The silos are coming down because the organization needs to move more quickly and be agile as a unit. And so they're adopting Teams, or they're adopting Slack, or they're adopting tools to do what they do better, and they're not allowing it to be department by department conversations anymore. So I think the tech innovation, the tech investment, and how much that has fast forwarded in the last months has been amazing, and I hope that holds on and those adoptions are made permanent. But I think we thank both of you. We very much thank both of you, Jennifer and Andy, for your insights today. I'm excited to see where some of these changes and new directions go. I mean, what could things look like 12 months from now, 6 months from now, if we stayed at this rate of change, and our board's minds were opened at this extent for risk and for investment. But we do hope that you've enjoyed your time with us too.
Needless to say, Andy and I will be on our US wide book tour in 6 months, promoting what the BDA has done innovatively. So put that in your diary, Andy.
I'm looking
okay?
forward to it.
Well, but it has to be an ebook now. Those will be podcasts.
Yeah, has to be. That's right. It has to be Kindle edition first, and then we'll publish the paperback in 10 years' time. Yeah.
But we're so glad we got to talk about this. I think it's important, COVID related, but otherwise. And as we like to say, never let a good crisis go to waste. And this has been a chance to push the hand of the board, push the hand of the executives, and really see where we can take this for the benefit of the members and to advance those missions. So thanks again for joining us on Association Transformation, and we hope you've enjoyed your time. And next time we'll be sure to explore more issues and discuss more topics that affect the nonprofit community. So join us then, and be sure to find Association Transformation on your favorite podcast channel, and you can email us any questions you have at hello@yourconsort.com. So thanks, Andy, thanks, Jennifer, and thanks, Andrew, and Andy in the booth. We thank you all for being with us, and we'll see you next time.